My name is Monique Brown, and my area of expertise is implementation. So taking the SmileSnap platform and making it work within your practice. I'm excited to be here to share some tips and tricks on marketing, creating a workflow, necessary templates and checklists, and other best practices on how to take advantage of the SmileSnap platform as both a revenue and lead generator within your office. We're going to get into the nitty-gritty details, and my hope is that I'll be able to help you navigate obstacles that I personally had to navigate in order to make your virtual consultations successful. Today, however, I'm going to take a step back and talk a bit about mindset, because it's important that you and your entire team are on board with meeting the modern dental patient where they are. And what I mean by that is, we as an industry have to acknowledge that dental patients in 2022 are not the same as they were in 2012, 2015, or even 2020. Dental patients today want convenience and transparency above all else. Fortunately, SmileSnap makes both of those things very easy, but not without some commitments from you and your team. So let's go over a couple things that you need to keep in mind as you start or dive back into virtual consultations. Number one, SmileSnap should be a top priority in your practice, which means responding to your consultations ASAP. Your patients expect instant gratification, so if it takes your team a week or two to respond, they've likely moved on. There are some smart ways to structure your consultations so that you can knock them out quickly, but for now, just know that a response time of 24 to 48 hours is preferable, but same day is best practice. Number two, virtual consultations are the new consultation, full stop. Your patients want to get the answers to their questions within the scope of the consultation. That means no holding back for when they come into the office. Yes, you should give them a treatment recommendation, even if it's a guesstimate, along with an approximate timeline. Yes, you should provide a price, and it should not just be the exam fee or the cost of a panoramic x-ray. Today's patients want transparency, and they're actually suspicious of anything less. So, don't shy away from your fees, but make sure you also include insurance, payment, and financing options within the consultation. Now, SmileSnap makes it easy to cover all of that in the template. Your mindset shift is understanding that the ideal virtual consultation should allow the patient to convert before they ever step foot in your office. That's the dream. Number three, virtual consultation platforms are not set it and forget it. It may take you and your team some trial and error before you find the right workflow, but it's important that you keep at it. Making a few tweaks to your templates, scripting, and the follow-up process can have a huge impact on your overall ROI. The point here is, don't give up just because you're not getting instant results. There's likely a breakdown somewhere in your workflow that can be changed, addressed, corrected with very little headache for a huge positive impact in the end. Number four, SmileSnap is not just for generating new patients. Okay, so I was a growth marketer for half of a decade, and I completely understand the focus on new patient acquisition. But your existing patients have just as much interest, if not more, in the SmileSnap platform. Think about it. These patients already know you, they trust you. That makes them much easier to convert than new patients. Think about how many of your current patients don't even know what procedures you do in your office, like veneers, whitening, or even virtual consultations. Do you have any information or signage about SmileSnap in your office? You should definitely take advantage of that captive audience. Emails, social media, and in-office marketing are all really low-cost strategies to make sure that your current patients know how easy it is to submit a VC. They may even encourage friends and family members who are not patients to submit, thereby bringing them into your practice as well. Number five, this is the last but the most important one. Manage your expectations. Every virtual consultation won't be a slam dunk, and this is especially important for my GPs to remember. You're probably not going to get back-to-back full upper arch cases. The SmileSnap widget makes it so easy for people to submit a consultation that you're going to get a huge variety of patients. So that's going to include people that are in pain, people that are just browsing, people that are price shopping, and people who are ready to start treatment. At first, this huge disparity can seem frustrating, but here's the thing. Speaking from my experience, a lot of those people in pain will come in and get emergency care, which gives you the opportunity to treat them, educate them about their oral health, and convert them, not just as emergency patients, but as lifelong patients. Your browsers and price shoppers may not immediately respond to your consult, but that's okay. I've seen people call after over a year to get started. So try not to focus on any expected result. Instead, perfect things on your end. The SmileSnap consultation is your opportunity to connect with that patient and show them everything you have to offer. Even if those patients aren't ready right away, they're going to remember you. Plus, you have a massive list of leads who have expressed interest in your business. They should be included in all of your email marketing for everything from patient education to special promotions. Take advantage of those people. Don't just think they didn't convert, now they're gone. Finally, I want to address the one thought process that you must correct before starting virtual consultations. This one is a non-negotiable. If you think they're a waste of time, they will be. Okay, so think about it. You might spend 10 minutes prepping and recording a virtual consultation on SmileSnap. Maybe you do a live video and it takes a bit longer. That patient may or may not come in and get treatment. If they don't, what have you lost really? 10, 15, 20 minutes? Now think about the alternative. That patient calls your practice, they book an appointment, they sit in your lobby, they get back to an op, they take up 30 minutes of chair time or more before you're able to get a diagnosis and an estimate, which they decline. You've definitely lost more than 10 minutes, plus the cost of turning over that chair. And unless they give you detailed feedback, which, let's face it, they usually don't, you won't have any idea why they didn't move forward with treatment. There are also any number of links in that chain before they got to that room that could have broken down. And the worst part is, you have very little control over most of them. In contrast, you can go back and look at your consultation, see what verbiage you used, what options you shared, what treatment you suggested. The next consultation, you can try something different. Experiment. See which things that you say or offer get the best result. Best of all, you're in control. And the SmileSnap format is a lot more informal. So if you want to shoot the patient who didn't book a message and ask, hey, did you have any questions or concerns? Maybe why didn't you move forward with treatment? You're likely to get a far more constructive feedback than you'd receive from an online review or a post-appointment survey. I hope this video gave you some ideas of how you should be thinking about virtual consultations. But more than that, I hope it got you motivated to dive back into your SmileSnap platform and commit to doing what it takes to make it successful and make it work for you. I'll see you next time.